Medication Administration, Module 1. In the main menu, click on the MAR. This will open up the MAR on the right-hand side. First thing we're going to explore is Nurse Review. To find Nurse Review in the MAR, click on the eyeglasses in the upper left-hand corner. If you hover over, it will say Nurse Review. In here, you are able to review all of your medication orders only. You will see an action date and time, who entered the order itself, and the details of the order. From here, you will be able to review your medications for their appropriateness for your patient. You can leave it on Select All, or you can uncheck Select All and check off individual orders to review. We're going to leave it on Select All for this video, and we're going to review all of our orders. The next thing we're going to talk about is this gray bar. In this gray bar, you can right-click. You can change your search criteria to see days back if necessary. Next thing we're going to look at is how the MAR is separated in different time views. We have a scheduled time view, unscheduled PRN. If I scroll down on the right here, I will see my PRN meds, and continuous infusions all the way at the bottom. We have several columns. The first column is where the medications themselves are listed, and then there's multiple columns thereafter. These columns on the right of where the medications are the specific times that tasks are fired to give medications. So for our digoxin, it is due at 8 a.m. It is in red because it is overdue. You'll notice the metoprolol has a red overdue for 8 o'clock, but it also has a blue task to give the medication at 8 p.m. because this is a BID med. The yellow column means today and now. Let's start with the icons and let's review them. The first icon we come upon is a sticky note with a push pin through it. That is a MAR note. You will always click on these icons because they contain very important information about the medication itself. This one happens to say to monitor the heart rate and blood pressure when you give digoxin. I'm going to use this back door here to go back to the MAR. The next icon we see is this yellow square with different colored shapes inside. That means that this order for this digoxin came from a power plant. The next icon is this mortar and pestle with a red circle and line through it. You'll see it over here where the task is supposed to be. This icon means that this medication has been rejected by the pharmacy. We never ever give a medication that has been rejected by the pharmacy. You are to call the pharmacy and call the physician to find out what your next action would be. The next icon we're going to look at is a mortar and pestle without the red circle and line through it. This means that this medication has not been verified by the pharmacy. Again, we don't give medications unless they are verified by the pharmacy. The doctor places the order, the nurse reviews the order, and the pharmacist verifies the order for medications. On this furosemide, we also have a note. We're going to click on that and open up the MAR note. It says caution, fall risk, monitor blood pressure. Again, these MAR notes are extremely important for you to look at. They're there for a reason. The next icon we're going to look at is this yellow circle on the influenza. This means that it is a one-time task. That means you'll only have the task for once, and it is a once order. We're going to click on this MAR note, and it gives you specific instructions on what to give your patient, whether it is a high dose or a low dose, depending on their age. The next sticky note we're going to look at is metoprolols. This one says, hold for systolic blood pressure less than 100 and monitor blood pressure. Now that we've reviewed the icons on the MAR, we're going to right-click on digoxin and look at some order information. In the order information, you have all the details of the order and who placed the order. There's a tab for comments, which is your MAR notes, additional information, the history, the nurse that reviewed the order, and the pharmacist who verified the order, validation, again, who reviewed it, who verified it, any results that may be attached to the medication, and a compliance history, which wouldn't be yet because we haven't given this medication. If we right-click again on digoxin, we're going to look at the reference manual. In the reference manual will be listed all the information about the drug, all the warnings, contraindications, altered response, and so on and so forth. This is information for you when giving the medication. It is a drug reference. There is an education leaflet. This leaflet can be given in either English or Spanish, and you'll be able to print it out for your patient. And all the way on the right is a reference link. This happens to link you to unit-specific IV bolus medications administered by registered nurses. Each medication will have their own reference link. We're going to right-click on digoxin again, and we're going to look at MedRequest. In MedRequest, you can have pharmacy send you a replacement drug if you've dropped or wasted, if it's missing in the patient's drawer, and you also can do unable to scan med. If you do unable to scan med, you want to put your cursor in the box and then scan your medication to have a number come up. This number then will be sent to pharmacy for you to alert them that the code that is on the medication does not match what the medication is. Again, right-clicking will give you order information, reference manual, and MedRequest. This concludes Module 1.